Welcome, everybody. Thank you for joining us today for another ITWebinar, this time sponsored by Logitech. My name is James Francis. I will be your MC for today, and we have a very interesting topic, the future of healthcare, specifically looking at telehealth. And what a fascinating topic. So much has changed in the last 18 months around digital in general. Yet healthcare is probably one of the great areas of potential that until this point have laid largely untapped. Of course, we have digitized rapidly. We've gotten so much better at engaging with these kind of platforms. And now we know that there is incredible potential on the table. But what is that potential? How can we make it work for ourselves and for the market? How can we make people's lives better through what are almost commonplace technologies? I am currently talking to you on a Logitech camera. It's a great little device, does everything I need. It really fascinates me that this one little device can be a conduit through to the world, to making people's lives better, whether they are far away from medical facility, whether they need to have chronic care. There are so many scenarios we can talk about that. Today's webinar will be all about that, and you are joining us today to hear from two experts who will be unpacking the topic. We'll be hearing from both Ahmed Awada as well as Heather Peacock, who I will introduce in a second. I just want to quickly bring up the house rules that you can use the chat channel on the side if you would like to ask any questions. We may not be able to get to the questions today, unfortunately, because we have so much to give to you guys today. But if you post them there, we will do everything in our power to get back to you, get the information to you, and we take it further than that. And without further ado, let's jump in on this, the future of healthcare. And to talk to us today on these topics, I'd like to welcome Heather Peacock. She is the Global Healthcare Marketing Lead for Logitech. Heather is IHMSS certified in healthcare technology sales and marketing. She also has an MBA from Arizona State University, and she spent over a decade in the sector. I'm really looking forward to what she brings to the table in terms of what technology and healthcare, how they combine these days. We also are joined today by Ahmed Awada. Ahmed is the Senior Manager for Virtual Health at MediClinic Middle East. Prior to this, he was the co-founder for Mobile Doctors 24/7 in 2015. He also has extensive history and experience in IT projects, agile software development, as well as developing solutions for healthcare, and he's a healthcare expert. We couldn't ask to be in better hands today. And as we go forward, let's have a quick look at what we are talking about today. If we look at our agenda, we are going to look at the drive for change. We're going to discover how the healthcare industry, my apologies, has been harnessing digital solutions to pivot during the pandemic. We are going to look at global healthcare trends in virtual health, obviously seeing what are we going to happen in the next few years. Also going to get an overview from Logitech, their technologies that they bring to this area. And that is going to be an area I definitely want to pay attention to, because that's an important part of it. The old days of bad technology, stuttering technology. I'm sure we can all remember 10 years ago, making a video call at all was an enormous pain. Now it's almost seamless, and I'm really excited to see what is coming next. And then finally, we will have a Q&A discussion if we have time for it, where we will unpack some of these topics a bit more. But without further ado, I would like to hand over to Heather and Ahmed, and let's hear it from the experts. Thank you, guys.
Thank you so much for that warm intro, James, and I'm so happy to be here today. So my first topic up is about the change drivers in healthcare's digital transformation. And while they are plentiful, I think what's most important up front is to make sure to reference the pandemic. Obviously, that has been the primary driver for change, and specifically within the virtual health space. It's completely shifted the care delivery mechanisms towards telehealth. I don't need to belabor this concept here, but we've seen long-term telehealth roadmaps that have ended up being condensed dramatically on a global scale. So going back, looking at the industry overall, even pre-pandemic, we had been seeing telehealth coming into the fold before the pandemic to address these challenges that you're seeing on the slide here. I think what what we have seen is that these challenges are impacting quality of care, access to care, the costs of care delivery, and telehealth solutions have started to show their value even before the pandemic. But then, of course, the pandemic hits, and it's very clear how much more how much more capable virtual care was at helping to solve the challenges. So we're seeing provider shortages, an expanding and aging population worldwide, chronic conditions that are only growing and increasing in their prevalence, and then these rising costs in healthcare. So as we've seen increased access to technology and to broadband, to internet, we've seen a dramatic shift in the availability of these technologies, or of technology-enabled care within households. I think the other thing that is important to note here is, as technology has pervaded our homes, we're also seeing pressure that the healthcare experience becomes more like what we are used to in our everyday lives. It's this concept of healthcare, or the consumerization of healthcare. I think this is largely impacting the demand for telehealth ongoing beyond the pandemic. So I think first up, we are wanting to do a quick poll to kind of level set where everybody's at from a telehealth perspective in their own personal lives. So James, do you want to take us into a poll?
Certainly, thank you, Heather. So if you guys can just head over to the poll section on the right-hand side, you see we have a poll there. When was the first time you engaged in a video-based telehealth visit? Since the start of the COVID-19 pandemic, before the pandemic, or never? Never, my apologies. Just go over there, make your selection, and we will give you about 30 seconds before we see what the results are, which we'll paste in the chat channel. And I suppose, Heather, while we have people quickly answering there, what would be your answer on this? Have you done much telehealth before the pandemic? Did you suddenly see a big jump since the pandemic?
100%. I've seen a jump since the pandemic. In my personal life, I had one fairly negative interaction about 5 years ago, actually at a HIMSS event, HIMSS, and the video quality was terrible. It was a very different experience. I would almost call it my first time having a real telehealth experience post-pandemic, or as the pandemic has hit.
Fantastic, thank you. And looking at the results there, I think for most people, it's since the start of the pandemic, and some of them still have not yet experienced it, which tells me that not only is this a revolution happening, but it's still a nascent revolution. There's so much that's going to still happen from this, and I'm very keen to see where that's going forward. So yes, I think people are very eager to hear what you guys are going to talk about today.
So Ahmed, I think you're up next.
Thanks everyone for being here. I wanted today to tell you about what was going on in telemedicine before COVID and after COVID. So before COVID, before going through the slide, I want to share with you the experience in telemedicine, how we were doing telemedicine before COVID. Before COVID, most of the teleconsultations that we were seeing were mainly a phone call or a voice teleconsultation. There was this barrier, the patients were not still in the video teleconsultations. Especially the elders. I would take an example of my mom. My mom was never convinced with speaking with a doctor over the video teleconsultations. But when the COVID happened and it forced the population to go through the telemedicine to be able to receive care, they were forced to try these new channels, and they were forced to enable the video, to see the doctor, to build this trust bridge. And you can see a whole change in the patient behavior. I would say 95% of the earlier teleconsultations were through voice. When the COVID happened, it started gradually to increase. Now we are looking at 40% up to 50% of the teleconsultations are being done through video. Still, some population, they prefer the voice because of preference or maybe limitation with their phones or the network, but there is a huge chunk that shifted to the video teleconsultation. And the video teleconsultation started to build this bridge between the patient and the doctor. before, when you were talking to an elder about having a doctor over video teleconsultation, they were not taking it seriously. They wanted to see a doctor in person. You wouldn't trust the doctors in the other hand, the other side that he's speaking through the video. But now they were able to speak to the same doctors that they were going and visiting in person through video teleconsultation, which did a huge shift in building the trust and enhancing the patient experience. Now, I want to take you through what happened in the whole industry. We have seen the accelerated patients adoption. I remember in 2015, we were trying to offer telemedicine services to our partners and our clients. It was a bit challenging. Now, when the COVID happened, companies were asking for these services. So there was a huge acceleration to the adoption of telemedicine services. The enabling of primary care, we started seeing patients going to the primary care channels, and that's a new change that we have seen after the COVID. The new healthcare delivery method. Before, patients were used only for the in-person. Now they are doing the voice and video teleconsultations for follow-ups, for the visits that they don't really need to be there in person in front of the doctor. And we are seeing a new model emerging, which is the hybrid healthcare model. It's a mix of the virtual and the physical worlds. And the insurance companies, they are highly adopting the telemedicine. Earlier, it was limited companies offering that as a value-added service to the population. Now, most of the insurance companies are offering telemedicine consultations to their insured members. The last one is solving technology challenges. There were many technology challenges that we were facing earlier before COVID, and when COVID happened, it all accelerated in terms of security, in terms of VoIP, internet bandwidth, and I've seen huge improvement in all of these areas. Now, I'm going to show you in this trend how the utilization happened of telemedicine in Middle East. We started the telemedicine around April 2020, and you can see there is a huge spike. It went really high, then it suddenly decreased. It reached to a very low number in August. Then we started seeing a slow growth, more of a sustainable one, not reactive like the earlier curve. The earlier curve was more of a reaction to the COVID. But when the patients started seeing the value and they started to see that this is a new way of delivering healthcare, it kept increasing, and it kept increasing in a sustainable way. So the message that I want to tell you from this trend, that telemedicine is here to stay. It's not only during the COVID and that it will be vanishing after that. I think it's going to be more and more embedded, and it will build more and more opportunities for providers in the healthcare system.
So thanks so much for the insight, Ahmed. This is very helpful. And, you know, I just want to reiterate, we know that telehealth is here to stay. I think we know that in part because you all have joined us on this webinar today. There is so much interest in this space. And, not only do I think that it's the patient seeing the value, I think there's also a clinical component as well. The clinicians, the providers themselves are seeing value that they hadn't in the past. Before I get into the next slide, I kind of want to take us back for a second to just an anecdotal story that is based on this famous book, at least in the US. It's by an American physician named Dr. Spencer Johnson. It's called Who Moved My Cheese? I'm not sure if anybody on this call is familiar with that book, but it's really all about change management and adapting to change. I think one of the biggest lessons from that book was the opportunity cost of holding on to something that, in the case of this book, they make it a little playful and talk about holding on to old cheese when there's new opportunities, new cheese that's better and more tasty and waiting for the taking. And I think we do that a lot in life in general, that we hold on to things and are resistant to change. And what happened with the pandemic, as horrible as it has been, is it forced this this catapult of change when it came to the virtual care space. Prior to the pandemic, we had seen so much difficulty getting telehealth to take a foothold, and that has completely, of course, altered. I have a 3-year-old who I'm really hoping doesn't come in here during this webinar, and I've got this story about holding on to cheese, where she was having some behavioral troubles at school before the pandemic, and I did everything but change her school. And then the pandemic happened, and what happened? Her school shut down, and I had no choice but to change and move to something different. And what was so interesting is what a fantastic opportunity that became for my daughter. All of the behavioral challenges went away, and suddenly she was thriving. Not only that, but I was thriving too in a different way. I didn't know what I didn't know about other opportunities that were out there. My experience as a parent was much better with her in this other school, in this other form of care delivery, if you will. And I think, that can relate very much so to what happened with the pandemic in general and how clinicians have been delivering care. I mean, I don't want to equate the situation by any means, but I discovered that, there's opportunities where I didn't realize that they were before, solely because I was forced into it. I think clinicians are starting to see some of those benefits as well when you look at the rates of burnout that are just so unfortunately high for clinicians, and especially during the pandemic. I think they're seeing that their experience as providers is also improving. They're seeing better engagement from their patients in this way. They're getting an entry into patients' homes in a way that was not previously as pervasive, to say the least. You're seeing behind them, you're being able to evaluate a full person, and it's just such a better experience. So let's move on to the next slide, please. So of course, we're seeing these clinicians accepting and adopting virtual care tools in a far greater way, and that resistance threshold has been lowered dramatically. And to Ahmed's point, there was this slight drop off for a period, but now we're seeing it grow again and start to be at a more sustainable level. I recently spoke with an IT director at a large health system in Florida here in the United States, and she shared that she had been dreading a imminent change coming and the change management that was going to come with it within the next 2 years. On the roadmap, there was this plan to offer telehealth. But what instead she saw was that it was offered in 2 weeks because of this horrible pandemic, and there was no change management. But at the same time, there was practically zero resistance. And this necessity has ended up driving these long-term paradigm shifts. We're seeing, if you look on the right of this slide, Frost & Sullivan, a large analyst firm that is recognized globally as a force in the healthcare technology space, and understanding what's happening in the market. Globally, we are seeing major double-digit growth over the next 5 years. In the U.S. alone, we're seeing over a 40% compound annual growth rate. That's true really across the board as we look regionally. And there are so many reasons for that. I think they're extending access to care in ways that we haven't previously been able to. It's affecting experiences of both patients and providers. And then ultimately, it's also affecting the cost of care. And I think that as we look at this, we're seeing these astronomical growth figures specifically because of all of these benefits that telehealth can provide. So Ahmed, why don't you share some of your perspectives on the post-COVID opportunities in telehealth?
Yes, sure. So we call it in MediClinic the telemedicine 2.0. the post-COVID-19, how the telemedicine and virtual health will look like. So we start with the opportunity. What is the opportunity for us there as healthcare providers? It's the virtual horizontal expansion. Instead of building more clinics and hospitals, which I think that we have enough of that, it's having the same expansion for new areas with the same facilities by providing virtual health and virtual and telemedicine, where you can treat patients remotely and you can even do remote diagnostics remotely. Providing the second one, the vertical expansion. Now, the future of healthcare is building more services and products. The more clinics and more facilities are decreasing, the more that we are seeing is more products and services, chronic disease management, telemonitoring, prenatal and postnatal programs, these kind of services. And also providing the patient with the one-stop shop. The patients are looking at healthcare the same way that they are looking at using Uber, using Facebook. They would like to do everything through one place, and it should be very user-friendly. And that's something that we are trying to provide. Improving the health outcomes. When patients are complying with their treatment plans, the results are really good, whether it's a chronic patient or acute patient. So using such technologies and using the telemedicine services, we can definitely see an improvement on the patient utilization for healthcare services. For example, outpatient services, inpatient, the hospital stay, and we can look, for example, in the telemonitoring services. So when we take the patient from the hospital setting and we put him at home and we are able to monitor all of his readings, he's feeling the sense of safety that he doesn't need to go to the hospital and stay there to feel that someone is looking after him. We can definitely look after the patient while he's sitting at home. So with that, we are able to have a direct impact on this inpatient, outpatient, hospital stay. And with all of that, we are able to build new business models. And here when I'm talking about new business models, we are talking about capitation. I'm sure the people in the US, they're familiar with that term, and many companies like Kaiser Permanente and other companies as well are doing this model where they take care of all the patient needs and provide him with a unified entry point for all of his needs. And they focus on providing the patient what he really needs, not what he wants, what he really needs for his healthcare needs. And we are also able to leverage the medical capacity. Because of these digital solutions, the doctor doesn't need to be squeezed in the time that he's offering the service. We can distribute the services in his working day. So some services that he can offer in the morning when there's low peak, and some services he can do it in the evening when it's high peak. We are trying as much as we can to push the services, the virtual healthcare services, in the low peak in order to equalize the doctor utilization, not to have a time where he's over-consumed, another time where he has a low peak. So we are trying to leverage the medical capacity to offer more services and to help our patients. So the area that you see in purple, these are all the channels that we are looking at to implement telemedicine and virtual health. It starts with the virtual consultations, normal teleconsultations that the patients are having. Then we are having the coordinated care where the patient will call us and we will try to provide him with the right level of care. If we cannot treat him virtually, we will refer him to a specialist where he can get his secondary care. The chronic disease management, many of the chronic disease conditions, they don't need to be managed by having the person coming in person, and he doesn't even need to go and see a specialist. This can be all done in a primary virtual care setup. The remote patient monitoring, where we can monitor the patients from the comfort of their home, so he can sit at home and he can just take his reading. Imagine that he's taking his temperature, just the normal behavior that he's doing, and this reading to be automatically synced in the background and to appear to our doctors, and doctors monitoring that on a 24/7 basis, and they can intervene if needed. This intervention, it could be a phone call, it could be by sending a nurse to his home, it could be multiple ways. Then you have the mental health. And mental health, when we are looking at the patient's mental well-being, it has the psychological part, and it has also the health part. And the way that we're looking at adding the telemedicine component, that the doctor, the physiotherapist, the psychiatrist or the psychologist will be looking at the mental health, plus having a component where someone will be looking at his physical health and medical side of that. Because in many cases, the mental health has an effect on the chronic patients when they start not complying with their treatment plans and deteriorating. The home care, where we send the nurse to the patient house, and we can do even a teleconsultation from the comfort of the patient's house. So the nurse will be doing the blood sample collection, will do the sophisticated readings, something like the ECG, while she can connect to the doctor with just a click of a button. He will be able to speak to his specialist or his primary care doctor. Looking also at the long-term care, these are things that we are exploring heavily, that we'd like to provide long-term treatment plans that has the telemedicine as a major component in it. I won't be able to detail more on that here, but in MediClinic, because we have still we are still planning on this bit, but I can tell you what they do outside MediClinic. They go even as far as a home ICU setup. That's something that we will be exploring, but I cannot promise anything there. But I can tell you, outside MediClinic, they are doing a home ICU setup where the patient can sit at home and have this maximum level of care, even having the physiotherapist at home or doing physiotherapy virtual sessions. Then we have the health kiosks, and the health kiosks are something new. I worked personally on one of these projects and built it from the scratch, where you can have a booth, and inside this booth there is a screen, and this screen is connected to very good devices, FDA, CE approved IoT devices, where the patient can take the reading, and this reading will immediately appear to the doctor, and doctor can consult and can diagnose the patient with the condition. This health booth could be set up and placed in a rural area. It could be in an oil rig. It could be in a school. It depends on the use case. There are multiple use cases for that. And we see that this is something that will be implemented in the very near future. With all of that, it's formulating the future of healthcare. And the way that we are seeing that the formulation is happening, that it's becoming more proactive, less reactive. And instead of the patient waiting until he's very sick and to start going, with this virtual setup, we are seeing more of a proactive approach, where there is a follow-up with the patient, virtual follow-up, there's further engagement. So it doesn't need to wait until the patient health is deteriorating and he's very symptomatic, then he can approach the doctor. We are seeing also cross-continuum care system. It's not looking only at the patient health only during his visit in the hospital. It's looking before his hospital visit or clinic visit and after the hospital or the clinic visit. So it's looking at the patient before, during, and after his hospital experience. And not only that, it's looking at acute, chronic, and healthy. So it's a very, very comprehensive, actually, and covering all the patient needs. Then you have the quality and the safe, accessible care. And here we are looking at having multiple entry points for the patient. So patient can enter the healthcare system through a normal phone call to a toll-free number, through the mobile app where they can do a video call, or they can request a service from the app, or they can go to the clinic or the facility. We are looking at a cost-effective model, because if we are able to deliver a good healthcare service, we definitely can impact the healthcare services utilization. As I explained earlier, that if the patient is complying with his treatment plan, it will definitely have a direct impact on his outpatient visits, inpatient, and hospital stay, and also the emergency admissions. The new healthcare system that we are looking at, it's a patient-centric. And when I'm saying patient-centric, I'm not talking about just the user experience. I'm talking about the condition as well. So instead of the patient going for each condition to a different specialist, and not to have like a unified entry point that manages his healthcare, the future is going to be more of patient-centric, that he's entering a unified entry point, which could be the primary virtual clinics. And from there, it will start the care coordinations for all of his needs. But the primary care virtual clinics will be looking at the patient from a holistic point of view, where they are looking at his diabetes and hypertension and other conditions, even acute conditions that will occur. We are seeing the future also in the diagnostics. And I would like to call one company that I think they have done a major achievement there. It's a ITWebinar, where they are able to give you a kit where you can do the home diagnostics from the comfort of your home. You can have it with you can use it with your kid. It's a kit that they give it to you, and it has a stethoscope, it has otoscope, it has oximeter, all of that in one device that you can use, and it's very user friendly. So we are seeing more and more companies coming in this area where you can even have the diagnostics at home. So you can take all of these readings, and the doctor will be as if he's sitting with you and listening to your kid's chest or to your chest. And not only that, not only this remote diagnostics, we are seeing even more than that, which is the wearables. The wearables are getting more and more advanced, where you can get more readings out of it. Not only the oximeter, not only the heart rate. We have seen wearables that is still in the innovation stage, where they are trying to get blood pressure reading. Even the new Apple Watch has the ECG. So we are seeing more and more of that, which is helping the doctor to diagnose the patient while he's sitting at home. He doesn't need to come to him. He can do many of these that he was doing through the virtual channels. But we are not, again, with all of these things that we are discussing, we will never stop the patient from going to the facility or the clinic. This is the hybrid healthcare that I was talking about. There will be a virtual component and a physical component. And we are looking at the primary virtual clinics as the entry point for all of that. So yes, we are very happy actually to where it progressed. And it's very inspiring listening to all of these stories, to be honest, that we hear about the mothers that they were able to get care for their kids, the elders that they were able to get care during the crisis, especially the one that they were very high risk to COVID. So thanks a lot. And back to you, Heather.
Ahmed, do you want to tell us a little bit more about this embedded experience that MetaClinic offers?
Yes, sure. So what we are currently working on is providing this embedded experience for our patients. That's more of the one-stop shop. So it will be as simple as first contact with the mobile app or our digital channel, where the app will ask you about your symptoms. You can share your symptoms. You can go through an AI symptom checker. And after that, if your condition requires to be discussed with a doctor, you will be able to chat with one of our doctors in the digital clinic. And you can definitely upgrade this chat at any point of time to a video or a voice call. But we have seen that the chat has a huge adoption in many of the use cases that we have seen in healthcare. The next one, if you need to be seen by a specialist, you will be able to be booked an appointment with one of our specialists. And then you can go and see the specialist virtually or physically. Then you will have your tests, and all of that will be done through the digital experience. So even your test results will appear in the app. Then you will have your virtual appointments, which could be a follow-up in your condition to make sure that everything is fine. Then you can purchase your medications. You can have it delivered to your home. You can access all of your healthcare data. We are trying to look at this experience as the one-stop shop where you can do everything from a single point. This is still the beginning at MetaClinic for this digital services, and we are excited about it, and we are looking forward to have more and more of these. The ultimate goal will be to provide the platform or the channel where the patient will be able to get all of healthcare needs, whether he's acute, chronic, or healthy person.
This is very interesting, and it's so true that this embedded experience is exactly the kind of thing that patients are really starting to demand going forward, right, Ahmed?
True. As I explained earlier, that the patients now are looking at healthcare the way that they're looking at other services that they are using, how they used Amazon, right. How they are using Netflix, and how the healthcare experience is developing and progressing the same way that you have seen the VHS tapes became now a Netflix platform. It went from VHS to DVDs, Blu-rays, to Netflix, and now you have Netflix for everything. It's all in demand. The patient experience should be the same thing in healthcare. It should be allowing the patient to be in control of his health. It's not going to be exactly like the video on demand, but it should empower him when he decides to take care of his health, improve his well-being, get the proper guidance, get the proper engagement. I'll give you a quick example. I'm sure that many of you bought this Fitbit and used it for a couple of months, then they stopped using it. I stopped using it myself at a certain point because I felt that it was a silo kind of experience. But what I find it very useful, if you're able to bundle that with a wellness expert that he's looking after you, checking with you your progress every week or maybe every month, once a month, this kind of engagement is very needed. So yes, I believe that the patient would like to be in control of it and he wants to have a rich experience.
Definitely. So let's move to the next slide. So the big question is around reimbursement. And I think what we're seeing is there's still a lot of questions to be answered here, but we are seeing momentum here like never before. Governments around the world are utilizing these telehealth services to really reach that underserved community. It's bridging those gaps in care delivery. And you know, you've mentioned, Ahmed, a few different examples of how this is really helping to serve the underserved population. And I just got back from HIMSS, the Health Information Management System Society, I think is what it stands for. I got back from their global conference. It's the largest health IT conference in the world. And that was just happening last week here in the US. Really happy to get a chance to see all of the latest and greatest on what's happening in this space. And one of the big things that was referenced in multiple sessions, but one in particular, was around utilizing the schools in a different way. And I thought this was a really innovative concept that, of course, we've had school-based healthcare for a very long time, I think in the US since like the 1960s but in the last few years, and certainly as telehealth has become more clearly valuable across the board, we're seeing these schools really around the world, but very in the US, starting to reach the patient populations through school-based healthcare. And you know, I think one of the things that we need to focus more on is the ability to prevent future problems based off of lack of access to care. Children are very frequently unable to get to the care they need without sacrificing education, sacrificing their parents' wages. There are many reasons that they struggle to get the care that they need up front. Think about the behavioral problems, as I talked about earlier, as well as just general mental health. This is an area where virtual care is coming into the fold and bringing solutions for these children within the school-based systems. For example, in one of the sessions that I was in last week, they were talking about bringing in a high quality webcam so that you could have a really meaningful and personal connection with a behavioral specialist on the other line, and being able to deliver therapy to these children. Also primary care, being able to outreach and do preventative medicine and wellness checks. Doing that virtually provides the parents with a benefit of not having to leave school. It's also providing the children, leave their jobs to take their child to an appointment. It's also providing those children a benefit of not leaving or minimizing their time away from their education. It's such an important thing, and it was such a positive outcome of utilizing virtual health. As you can see across the board here, I mean, the concept of convenience is a nice to have, but the concept of access, just overall, it's not just about it being convenient. It's about the care literally not being available without the option of virtual care solutions. And we're seeing so many different opportunities to affect the overall health equity of the world, really, through leveraging virtual care solutions. And it's just very exciting to see such an impactful technology being able to come into the limelight finally. So Ahmed, can you tell us a little bit about, a little bit deeper into one of the main use cases, I think, going forward for telehealth?
Yeah, the emerging use case. That's my favorite topic, actually, the chronic patients. Yeah, so the chronic patients, as of today, they live in a reactive system. The healthcare professionals, they rely on the patients to contact them when they have noticeable symptoms. When they start feeling very sick and their healthcare is deteriorating, then they start communicating with the doctors and going to them and seeing them. The way that we are seeing it in the future, that it's going to be more of a proactive approach. We are not going to wait for the patient to deteriorate. We need to be engaged with them closely to make sure that their health is good and they are getting better, or at least they are in compliance with the treatment plans where it maintains their health. There is a primary care effect, and in the UK, 78% of the consultations at the primary health care are for people with more than one chronic condition, and the coordinated care for a wide group of problems in one individual. That's the primary care effect that we were talking about in the earlier slides. That in the UK, and this is a very good model where it's showing that they were able to care coordinate for all of their conditions through the primary care setup. And that's what we believe that will be in the future. There is a need for integrated strategy to promote the patient's overall health, preventing and delaying the health deterioration, ensuring the continuity of care across the providers. We see that it shouldn't, the healthcare system shouldn't be focused on one provider or in one condition. It should be inclusive of all the providers that this patient is seeing and all of his conditions. There is a huge impact by the lifestyle. We can say that 90% of obesity or the diabetes and cardiovascular diseases are contributed to be a patient's lifestyle issue. And that's why we are encouraging also not only the medical plans, also to push for prevention plans and wellness programs, where it looks after the patient, exercise and meals and activities, making sure that he is active and taking care of his health. There is an aging population problem which is happening, and you can see in the aging population in the US, majority of chronic patients are over the age of 65. 80% has one condition, 50% have at least two conditions, which puts more pressure on the healthcare system and forces us to be more proactive and to provide a solution, not to be just reactive and treating this population. We should not wait until their healthcare condition is deteriorating. And we can see that in the healthcare expenditure, that in the UK, 64% of all the outpatient appointments and over 70% of all the inpatient bed days, those patients are estimated to take up to £7 in every £10 of the total healthcare and social care expenditure, which is a very high number. And if these patients, we are able to engage with them, get them to comply with their treatment plans, have for them accessibility, and to provide the customization and building this humanization of the digital experience with them, especially the humanization of the telemedicine. And that's why we believe that video teleconsultations are actually helping with that. This will enable us to decrease this cost that the healthcare systems are paying as of today. And the last one is the mental health, and there is a need for regular checks and engagement to ensure that depression does not affect the day-to-day functioning abilities of the patient. Because once the patient is depressed or is having a mental health problem, they start going outside their treatment plan and they will be less compliant. So the future of chronic care that we are looking at, based on all of these points, it's more of a proactive approach, not to wait for the patient until he's very sick, for us to be more engaged with him, to be inclusive of different kinds of patient personas, also the people of determination, different types of patient conditions, the acute and chronic, to be inclusive of all their healthcare needs, to be patient-centered, to be focused on the patient, not on a condition or two, to be looking at the holistic approach of treating this patient, to be accessible. The patient, if he's living far, if he's not able to come at certain point, it should be accessible for him at any time of the day. It should be accessible from anywhere. And that's why the virtual healthcare is helping with this bridge, helping to provide accessibility from wherever you are, from at any time. And to be the last one, cost effective. And we believe that this can be accomplished if you are able to provide a real solution for healthcare industry. I believe that the virtual health has accelerated the adoption of many of the technologies that we are talking about for healthcare. And now the goal that we are trying to achieve is bridging the virtual world with the physical world to provide this continuum of care for the patient.
Absolutely. And, another strong use case for telehealth that's coming out of that with this hybrid concept. In an emergency setting, obviously, you're going to have physical care taking place. In a mobile care setting, in general, there will be physical care taking place. But I want to focus on emergency care and ambulance services and some of the really interesting and exciting things that have been happening there. Think about a stroke victim or a telestroke unit, the opportunity there to be able to reach a patient faster, and when literally every second counts. Within the first 60 minutes of a stroke incident, that's when treatment has the most effective, can be most effective, and obviously, can diminish permanent damage and potentially have a stroke victim fully recover. Unfortunately, based upon access to neurologists, access to or the literal travel time to a facility, there are so many different factors that cause emergency care in a stroke setting to not happen within that 60-minute window. If you have a telestroke unit that is video enabled and gives access to that provider that's on site somewhere, so access to a neurologist in a more, let's say this is a rural setting and you have a patient that needs neurological care but is not able to receive it even at their local hospital, there's an ability through these mobile care telestroke units to be able to loop in the larger, more regional hospital, and that can provide access to a neurologist on site while they are in transport. They're able to start those treatments that are so vital when every second counts. I think this is certainly not the only use case for mobile care. There are many different ways in emergency and also in mobile care settings, just in general, where access to video-enabled telehealth is so beneficial. We talked about, or Ahmed talked about the telemedicine kits that they're deploying. Within those kits, oftentimes there are actually Logitech webcams that are helping to be able to have that interaction on site, assess situations, and really be able to start that treatment immediately or fully at home without having to come to a facility. So the next part of this presentation is really about how does Logitech come into play in this conversation, and I want to make it clear that this is not going to be a major pitch around all of the different solutions that Logitech provides, but I really want to share how we're really hyper-focused on rethinking what's possible and bringing health equity to the masses. We are trying to minimize that distance between care delivery and the patient, and bring eliminate these boundaries between the care provider and the patient. So how can we make it better? Well, when we come into the, when you think about Logitech, we are very unique in that we are large enough to have a solid global reach, and we also have partnerships that are plentiful, and our capabilities are plentiful through the fact that we are a large company, but we are also design focused and focused on not just doing technology for technology's sake. We are doing technology that solves problems, or we're creating technologies that solve problems. Technology for technology's sake has absolutely no place in our DNA, and it's very important to us that we are solving major challenges. We are the market leader in several key product areas across verticals. We're trusted by healthcare providers around the world. We are the market leader in the video conferencing space overall, and that is definitely helpful to us to be able to gain those insights from the marketplace to make sure that we're designing that solutions that do meet the needs of our clientele. We're also, I think it's important to note that we are all at Logitech, we're all caregivers, we're all patients, we're all friends of countless patients and clinicians, and we, through this pandemic, have experienced so many of these challenges ourselves personally, and so we're seeing a lot of the value that what we're doing provides, and we're very invested in making a difference in this entire healthcare community and the global community at large. We are committed to the healthcare space in that we believe providers should be empowered to naturally build trust with patients. It should be regardless of the geography, regardless of the setting, and there should be this seamless continuity of care wherever patients are needing support. So sometimes that's not going to be related to an actual video-based call. Sometimes that is going to be an audio-only call. We have solutions that help with that. And then on the other side of the coin, we have a broad breadth of solutions around the video enabled care. And so ultimately, what we see is that we're able to help you as providers deliver better care through these digital health services. And as it continues to evolve and expand, we're providing IT teams with these solutions that elevate that experience for all, and enhance ultimately the effectiveness of virtual care. I started to talk a little bit earlier about the first experience I had with telehealth, and I'll never forget that I was on video and my provider was not. They had a black screen on the screen, and I said, wait, I can't see you. And she said, don't worry, that doesn't matter. I just need to be able to see you. I think this pandemic has completely shifted the mindset of clinicians in recognizing the value that human-to-human connection can bring. So our solutions are really bringing clarity and confidence to these remote healthcare interactions. And as we discussed, trust, we believe in connecting, delivering that seamless connection. And we're doing that through these integrations and really providing that flexibility to our customers. We're empowering you to be able to have these really meaningful connections between you and your patients, and making it it easy. We're extending care into communities that previously weren't receiving it. And ultimately, all of this is helping to optimize where you're putting your budgets, and by we're delivering cost-effective solutions to you out the gate. And then there's, you know, the total cost, and ultimately what our solutions are doing is helping to make it affordable to deliver this video-based care, but also to have those other indirect benefits from a cost perspective related to care delivery and length of stay and admission in the first place for many of these patients that you're able to just be able to deliver care to remotely. And these are just some of the examples of where our solutions are being integrated. We've got a few CART solutions here. CARTs are a big way that telehealth is coming into the inpatient settings, or even within exam rooms themselves. We're seeing more of our solutions going into those spaces. And there are many other examples of where we're being leveraged, but these are just a few of them if you care to take a peek at those at a later time. And then, as I mentioned, you know, we really do believe that we're better together. Our solutions don't work without these partners. And these are just some of our healthcare specific partners, or those that are very active within the healthcare space. But we have many other partners that we work with across Logitech and across the video collaboration division. So I won't go into all of the details here, but just to give you a couple of examples of some of the solutions that we are offering in this space, we are providing personal collaboration solutions or desktop solutions that are enabling our providers at their desks. Also, I mean, this can be extended within or into the homes. So whether it's a provider in a facility or a provider at home, we have solutions across the board that deliver a great desktop solution so that you're able to have personalized interactive care experiences and increase that engagement. You see here two of our key products in the healthcare space. We just launched the Zone True wireless headset earbuds. Those are a great solution to be able to have that clear audio coming through in a flexible and mobile way. And then also the Brio camera that you see on the bottom. Oops, I think we've moved on slides yes, thank you. So the Brio camera is our premier 4K camera that I'm using right now, and that we are recommending across the healthcare space. And then the next solution is our Meetup. This is very widely deployed within healthcare. Its form factor, the all-in-one form factor, makes it a really great choice within the healthcare settings. It's also has a wipeable surface that is very widely leveraged within patient settings, and it's helping to enhance that collaboration and productivity of these telehealth sessions. And then lastly, I will touch on one of our other solutions. And as I mentioned, this is just a small sampling of the solutions that we're providing the healthcare space. If you are interested in learning more about these, we certainly would be happy to have a follow-up conversation with you. The Rally camera is a pan-tilt zoom camera, which has a 15 times optical zoom. We are seeing this deployed to be able to really hone in on a specific issue that a provider is wanting to be able to see from afar. So within these patient room settings, we're seeing specialists or providers doing their rounds from home, being able to do a far-end control capability of being able to look at that patient more closely and get that high fidelity image quality out of that. So they're able to have a more effective virtual care interaction. And so ultimately, I think what we really want to make sure that we get through today is that we want to rethink what's possible from that patient bedside, provider's home, and everywhere in between. We hope today that through sharing what we've seen in the market, we have helped you to continue rethinking what's possible in care delivery. So thank you all for your time. And James, I'm not sure if we saved any time for questions, but happy to take some if we do.
Thank you very much for that, Heather and Ahmed. That was incredibly insightful. We do have about 3 minutes left, so maybe let's just squeeze in 2 questions, one for each of you, and then we can conclude it. And I suppose, Ahmed, let's jump to you first and just ask, what are the challenges that you foresee for telemedicine going forward? I mean, we're painting a very nice picture of what is possible, but what should we be looking out for that might be barriers?
I would touch on only one point, which is the most important point. It's the tariff. There is an impression, or I think some misunderstanding about the telehealth service, that it's a cheaper service, but in reality it's not. It's the same cost that you're having running a hospital or a clinic where the doctor is sitting. It's not really cheaper than the normal consultation. And that's the biggest challenge that I'm seeing, that the payers, whether they are insurance or government, they think it's a cheaper consultation. We are trying to change this understanding. It might be a cheaper consultation if the company is a telemedicine provider, a standalone provider, where they are not part of the continuum of care, just the company which is offering telemedicine services. That would be the case because the setup is much smaller. Even the space, they don't have the same structure of a hospital or a clinic where we have the sophistication of quality and the procedures, the policies, all of that. So there's a bad impression about telehealth, that it's a cheaper way of doing healthcare. That's I think the biggest challenge, the tariff. And that's something that we are trying to address with the regulators and with the payers, that it's the same service, just in a different way. What will be the cost-effective bit of the telehealth? Its impact on the patient health. Once you have this continuous engagement with the patient, then you will see that the overall healthcare service will be more cost-effective. Then you'll have some savings, but not on the service which is provided as a teleconsultation with the patient. So that's the biggest challenge that I'm seeing at the moment. I hope that this answered your question.
It did, and it speaks to, like with all technology, there's always a cultural shift that also needs to come into it, and this is probably the next big wave on that. Heather, last question to you. So, what happens when we shift back to in-person visits? Well, this just kind of, is this not just temporary? How do you respond to that kind of criticism?
Yeah, I mean, you know, we've heard repeatedly today that in-person care is always going to be a necessity. I mean, there are certain procedures that just cannot be done virtually. Everything from surgical procedures to certain equipment that will likely never be virtualized. But telehealth is proving that it's going to continue to fill this severe gap in care and in care delivery in these underserved communities, et cetera. It's resilient. We're seeing it get better even in the last year and a half. We're seeing so much adoption and just improvement in how care is being delivered through telehealth. And, you know, I got a chance when I was at this conference last week to hear some kind of anecdotal stats that I should probably source, but the net of it was, before the pandemic, we were seeing like less than a percentage point of care was being delivered virtually. And then the pandemic hit and we were at 14% of care was being delivered virtually. And then now it's kind of leveled out at this 7 to 8% of care interactions are happening virtually. We think that number is, I mean, it's going to continue to grow based on all of these different services starting to come into the fold of being offered, as Ahmed was talking about before. So I think this shift back towards in-person care is a great thing in many respects, and there's really just additional opportunity to serve patients better utilizing virtual care.
Well, thank you, Heather. And I suppose what we're also hinting at there is the possibility of hybrid care. You know, more models, more ways to approach this. And I think a very welcome revolution for the medical industry. This has been really good. Thank you, guys. It's been very great presentation. I so wish we had another half an hour so I could just ask you some questions here, unpack this more. I truly think this is one of the most exciting things happening in the world right now in terms of technology and the real world coming together. And this is from somebody who's been covering technology for 20 years. And I'm really looking forward to what comes next. And honestly, before the pandemic, I also thought that this would never work. People are too stuck up about this. And now look where we are. So it's been fantastic. Yeah. Thank you very much for being with us today. So we heard today from Heather Peacock, the Global Healthcare Marketing Lead at Logitech, as well as Ahmed Awada, the Senior Manager for Virtual Health at Mediclinic Middle East. Heather and Ahmed, thank you very much for your time. Unfortunately, we could not get to any questions from the audience, but we will respond to them. You can mail events@itweb.co.za if you have any questions that you want to ask from Ahmed or Heather, and we'll make sure that we get an answer for you there. I believe this recording will also be available, so you can look into this more detail. But certainly a topic I hope we revisit one day. There's so much more to unpack. There's so much to be excited about here. And thank you for taking time for explaining some of that for that. And with that being said, thank you to our guests, our audience, for joining this webinar, which was courtesy of ITWeb as well as Logitech, looking at the future of healthcare and telemedicine. My name is James Francis. I was your MC for today. Thank you. I hope we see you at the next one, and have a great day further.